Hi, today I'd like to share another patient case study that we've had recently. So this patient has a history of 2 chemical pregnancies and no history of a healthy pregnancy. So this is a primary recurrent miscarriage. Primary RSA because chemical pregnancies are also considered recurrent miscarriage, just that they happen within the first 4 weeks of pregnancy. So this patient has already went through over 21 OBGYN doctors in her country, which is Turkey, and she had gone through all screening, diagnosis tests, all the OBGYN specialists that can actually diagnose her problem, and no one found anything wrong with her uterine morphology, the reproductive functions, her hormones, her blood profile, but she still ended up having two miscarriages, these chemical pregnancies. So over the past 4 to 5 years, she has tried everything that she can to help her get a healthy pregnancy, because her age is starting to get a bit high, and then she might miss her fertile periods, so she needs to get pregnant as soon as possible. And she even considered something that we are very against, which is lead immunotherapy, lymphocyte immunization therapies. Upon just looking at her reports, we immediately can diagnose her for a uterine malformation. A very common one that we see is a naive uterus. A naive uterus can only be diagnosed using a HSG, which is a X-ray of the uterus. Now, she said that all 21 doctors that she went through said that her uterine shape and size had no problem at all. So now this is the difference between a normal OBGYN doctor and a OBGYN specialist. Only a specialist can tell the difference between these minor details, and these minor details alone can affect your pregnancy outcome, whether or not you have a successful pregnancy or a recurrent miscarriage condition. It really depends on these minor diagnosis details. So uterine hypoplasia or naive uterus is also a congenital uterine malformation, and is a known cause for a chemical pregnancy, especially a primary chemical pregnancy, where the patient has no history of a healthy pregnancy. Most likely, this patient, when her egg cells and the sperm cells are fertilized into a zygote, this zygote has been implanted on the uterine neck instead of the uterine body. Now, there's a lot of connective tissue here. Implantation site is not optimal, which led to her 2 repeated chemical pregnancies. And this was further confirmed when we looked at the HSG. It was a very obvious case of a uterine hypoplasia. So we immediately recommended her to get her treatment, because this type of condition is very easily treatable. She spent 4 to 5 years seeking help from any specialist that she could find. And immediately, less than 10 minutes, we already found her problem, and we are very sure that she can actually have a healthy pregnancy as long as she get her naive uterus properly treated. So in conclusion, to actually diagnose chemical pregnancies, recurrent miscarriage, these are very difficult and also rare pregnancy disorders, and you might need to seek out specialists in this area to actually have a productive result. You don't want to waste too many years going for lead therapy, doing what your doctor says, go for next pregnancy where they eventually end up in miscarriages. Our advice is that if you do have any pregnancy disorders, you need to seek a specialist who are specializing in treating these types of pregnancy disorders, and then you can only have the outcome that you want. So you don't have to waste so many money in IVF, lead therapy, and also several years of your fertile periods. You don't want to miss that. Even if you do miss that, then you might not be able to get pregnant anymore, and no specialist in this world can help you at that point.